Hello, good evening. My name is Joho, and this is our Monday special town hall coming to you live tonight from Aga Khan Academy here in the county of Mombasa, famously known as 001, County 001, the smallest by size, but one of the biggest by population and no doubt by profile. And in a short while, I'll be introducing our guests who are going to help us steer this conversation. But we also have a fantastic crowd here that is gathered, composed of residents of Mombasa who are going to spur the conversation here because they live here and they know all about universal health coverage, which is our subject tonight. And my colleague Mashirima Kapombe is going to be engaging the audience here, and right now she could just give us a preview of what we can expect tonight. Mashirima.
Na mjua kama ulivyosema, watu ni wengi katika kaunti hii. Kulingana na hesabu ya watu ya mwaka 2009 ni kuwa kaunti ya Mombasa ina takriban watu 939,000, na hapo waliojumuika kuna wahudumu wa afya walio kujitolea, kuna wale vijana wa kurekebika tabia baada ya kutumia mihadarati, kuna watu wanaoishi na ulemavu, na kuna watu wengine tofauti kutoka kaunti hii. Wako na maswali tofauti hususan kuhusiana na utekelezwaji wa ile ajenda ya serikali kuu kuhusiana na kutoa huduma bora kwa wote. Nisisahau pia kuwa wana maswali kuhusu majukumu ya KEMSA ambayo inatarajiwa wengi wanatarajia kuwa ndio inatoa vifaa vya matibabu na dawa katika hospitali za kaunti mbalimbali. Lakini John, najua pia hapo jukwani uko na wale ambao watakuwa wanapokea maswali yao.
Bila shaka, we have gentlemen here, 4 of them, and I'll start with the governor of this county, Ali Hassan Joho. Thank you very much for joining us. I know you've had a long day at the conference out there, but we are glad that you're here with us tonight.
Thank you, George.
Yes, we also have the CEO of KEMSA, Dr. Jona Manjari. Good to have you back. I understand you had some travels, but good to have you back on the panel tonight. Next to him is Alfred Sigo, who is from the Pwani Youth Network. He'll be telling us about that in a short while. And last but not least, we have Dennis Wali, who is from the CANCO, which is a community organization that deals with issues of access to health, and he's going to be talking to us a little bit about that. But before we get to our discussion up here, earlier on my colleague Mashirima Kapombe was doing some rounds in this county and got a sneak preview of some of the issues that the residents of this county are dealing with.
Mothers at the Coast General Hospital attend to their babies. Most gave birth to their bundles of joy just a few hours ago. This is Rose Ndune's 5th child.
Nalianza uchungu saa 5. Na saa 5 nikatoka nyumbani nikatafuta taxi mpaka hapa ngafika kama saa 6.
Rose spent 500 shillings on a taxi from Laleo in the county's Kisauni constituency to the county referral hospital. There is a sub-county hospital near her, but she doesn't believe that it can satisfy her healthcare needs.
Sijawahi kwenda hata siku moja. Na niliambia nasalisha na sijawahi kwenda kwa siku moja. Kwa sababu hospitali ndio nilipenda kwa roho yangu yote.
Damaris McKenna is another who spent 700 shillings on a taxi from Changamwe to the Coast General Hospital. This is her 3rd child, delivered normally, but she chose to bypass the Portrees sub-county hospital near her home to deliver here.
Kama ni CDF unaweza enda upate hata kuna daktari, unaweza pata daktari asubuhi saa 8, ukienda hakuna daktari wewe na ujui utagonjeka saa ngapi.
Mombasa County has a total of 42 health facilities, 1 level 5 hospital, 3 sub-county hospitals, 6 health centers and 32 dispensaries. The nurse in charge at the Coast General Hospital attributes the mother's choice of facility to preference.
So in the lower facility, we don't have the specialized care like where we have an obstetrician gynecologist like we have in Coast General. So I think most of them, they rather come here because they know even if they get an emergency, they are handled because the specialists are usually here.
In another part of Mombasa, away from the sun, sand and palms, the roads are in a poor state. Residents of Milango Saba, Vikwatani and Miramani decry the challenge in getting their sick to hospital.
Manake saa nyingine utakuta pikipiki zimekaba hapa barabarani. Ukiangalia matatu zimetoka Kongowea kule zimebeba mizigo zapita huko. Yaani unakuta mko squeezed kabisa, unaona. Paka ukiwa uko na mgonjwa wako mataka kwenda huko washindwa jinsi utakavyofika na iko hali mahututi kabisa.
Junda dispensary is not far from the residents of Milango Saba, but the patients seeking services here are few.
Unajua kama umeshindikana sasa itabidi uende Makadara, lakini unajua pako uanze hapa ndo kama daktari azokuandikia uweza kwenda huko mbele Makadara.
Tangu juzi ya kohoa, kuna kikohozi kikali na mwili moto na kutetemeka. Sasa ndo nikaona heri nimlete hapa Junda dispensary ndo aje apate matibabu.
Malaria, kukohoa, kuharisha, magonjwa ya ngozi na pia TB.
The dispensary is fully stocked with drugs and the nurses effectively attend to the ailments they can. Their supplies are replenished every 3 months, but they can only do so much with the 2 clinical officers stationed here. With the limited facilities, the cases they cannot handle are referred back to the Coast General Hospital and the cycle continues. Mashirima Kapombe, Citizen TV.
All right, a very brief preview, if you like, sneak preview of what is going on in this county. Obviously, it is a much longer story than that because you can't quite tell the story of a county in one night. But let me start with you, Bwana Governor. Very basic issues that we see in a lot of counties. And I'll start with the issue of people preferring to just go to Coast General directly, yet actually there's supposed to be a whole referral system. Ukiumwa na kichwa tu naenda Coast General. How serious is that problem, and why would you think that people don't believe that they can get the basic treatment they need from some of the dispensaries and other health facilities out there?
Well, I think first of all is a mindset issue, because maybe we may need to run some sensitization of some kind so that people understand the purpose of building facilities such as the Junda one and others is to try and primarily offer health care at your doorstep. And this really has been our focus. But it's quite a challenge for people to understand that we need really to turn our level 5 into a truly referral facility. So we are engaging. By the way, what you have seen, I can tell you there's tremendous progress. When we came in initially, a lot of our people opted for treatment at Coast General, even when they had just flu. But that has changed quite a bit, because initially, these majority of these facilities, for example, the dispensaries, were being handled by the now defunct municipality, and therefore there were quite some challenges, availability of drugs, personnel or human resource for that matter. And when we came in, we were able to effectively transform that. I can challenge you, you go to any of our facilities, level 2, level 3, and level 4, you will realize that we have drugs and personnel. Not in the number as probably some people would have suggested, but they are there. And I don't know what it is that we can do, but I'm sure majority of us are now watching this program. They need to understand that those facilities are there for a purpose. Level 5 should cover really as a referral hospital, because what we have in level 5, we certainly cannot replicate that in all the other facilities. So really, Joe, it's a mindset issue, but hopefully at some point people will get to understand.
I mean, I know you've been talking about, your government has been talking about some of the things you've done with Port Reitz or the Likoni sub-county hospital and all of that. But what do you say to those people who say, well, I'm not taking chances. I know if something goes really wrong, Coast General Hospital will help me, so I'd rather just go there directly without having to wait.
Well, we have invested in what? In the facilities, 1, 2. We have now ambulances. In Mombasa, there were no ambulances. In fact, when we got in, we found one ambulance that was working. We now have we have bought 6 new ambulances to cover the 6 sub-counties, basically so that when you cannot get the kind of treatment that you need from sub-county level or dispensary, we should be able to pick you up and bring you to the level 5 facilities. We are also working on referral structures, because a patient that comes to Coast General, there must be some reference to it. There must be a history to the patient, so that because the kind of doctors that we have, for example, in Coast General, we have consultants, we have senior doctors, we have specialists, that it won't be fair to hire an oncologist that sits at Coast General to treat flu, or to treat a chest infection. So we get you to do the very basic, and then when you come to now level 5, you get the treatment, the kind of treatment that you deserve, isn't it? So we will continue to talk to the people and inform them that, for example, I looked at that video in Vikwatani, and I know it's a challenge. That is why we opted in one of the areas where we have built a level 4 that is 99% complete. We're buying equipment now is in Vikwatani, because we want them to be able to get treatment within their vicinity or the area of residential.
Oh, okay, great. And some of the county residents are here, and we'll be hearing from them a little bit later. Dr. Manjari, I mean, many counties we've seen the whole thing of debt to KEMSA, that you supply whether it is medicine or whatever other medical supplies that you will be taking to the counties, and counties are not paying quickly enough. What is the status here in Mombasa?
Well, thank you, Joe. I want to thank His Excellency the Governor, Joho, for supporting KEMSA and buying from the organization. As of today, the debt of Mombasa owes KEMSA is around 14 million. That's a very small fraction as compared to the 2.6 billion owed by the other counties. And across the board, we are very glad that counties have started paying. Before the end of this year, before the end of this month, we have a commitment of around 590 million that will be paid by the counties. We better start from the positive, that counties have started to pay KEMSA. But we have the defaulters that we have blacklisted.
I'm interested in knowing what are you going to do about that, because
Yes.
2.6, 2.8, that's a staggering amount, and this is the same money that is supposed to be like a revolving fund that keeps getting medicines for these other counties. What exactly are you doing about that?
We
Are you
have
just telling
started.
them, please pay?
No, we have started a strategy. One of them is to engage the governors directly. The other one is to engage them through the Council of Governors. We also are engaging the county executive committee members of finance, of health, and the chief officers. I'm glad that we have a forum that we keep on engaging and posting, not really naming and shaming, but posting those who have paid to challenge the others who have not paid. Having said that, it is important to note that our mandate is to warehouse, procure, and distribute the commodities. It is better the commodities being in the counties than expiring in our warehouse. So it's a whole system that we have engaged, and we are very glad that as we move forward, and as the new act will be enacted soon, as the counties come now to buy directly to KEMSA, we will have a mechanism of ring-fencing the health funds, so that we know that if Mombasa's budget for health is 200 million, at least we'll guarantee them through drawing rights. And as they draw the commodities from the organization, we'll be assuring them that they will be affordable, they'll be of high standard, that is quality, and at the same time, we'll be able to distribute door to door of their facilities, because we have an elaborate system. For Mombasa, we have a depot, and this depot we want to decentralize and make it a distribution center. And we have a very big depot here in Mombasa, and we want to make it even more robust by ensuring that it is a distribution center
for
this
the
region.
for the rest of the region. Now,
Yes.
Alfred, one of the things that you have stated as your mission, so to speak, as Pwani Youth Network, is to push for the access or the right to health services for young people. What is happening with that? And when you hear these two gentlemen here speak glowingly about the things that they say they are doing, is that what the young people are telling you, the Vijanas of Mombasa?
Okay, thank you very much, Joe. I think the governor and the executive director here have actually talked very well in regard to some progress that the counties are making. But considering that Mombasa has a population of more than 1 million, and half of this population is made up of young people, then it means as a county we need also to invest more on young people, specifically when it comes to matters of health. The recent statistics that we have in regard to young people getting health care or the health facilities offering youth-friendly services, yes, I will agree that there have been some progress for the last 5 years, but we are still a long way because it is 19% of the health facilities within the county that are offering youth-friendly services.
What are youth-friendly services?
Well, youth-friendly services are just the normal health services, but specifically services that are directly linked to young people. Like, for instance, young people have issues of sexual reproductive health. That is very key when it comes to service delivery. And another thing is the issues of family planning to young people. Because we are saying that if a young person delay having their first child, then it means that that young person will have a progressive future. So if we are talking about youth-friendly services, we are talking about all the services, but specifically that are directly linked to young.
So what are you doing about it? Do you go to the county office? What are you doing? What are the young people telling you? Go do this and that so that we move this figure that you're talking about to where it ought to be?
Okay, for the last 5 years, we've been working with young people and actually training them as youth champions. And we've been engaging the county government in the budget making process. I think the minister will agree with me. We've been very loud to the county government to increase finances going to youth-friendly services. And for the last 3 years, we've seen some progress. We know Makadara, the referral center, has a youth-friendly corner. Portrees has a youth-friendly corner. And now recently, through a partnership between DSW and the county government, we have another youth-friendly center in Mikindani. And I think that is showing that there's some progress, but I think a lot needs to be done because young people are very dynamic, and our challenges, without us, nothing for us without us. So as young people, we need to take the mantle. We need to be part and parcel of this conversation. Joho, when we're talking about UHC specifically, where are young people in that conversation? And that is what we are actually championing.
And I will come back to the specific conversation on UHC and young people in a short while, because we will also go to the audience in the next few minutes with my colleague. But let me come to you there for a last comment before we do that. You are hearing all these conversations about progress, no progress, because we are still assessing the overall health status of this county before we delve into the preparedness or otherwise for universal health coverage. What is your experience? Kanko, you say you bring together civil society organizations, faith-based groups, and community-based organizations, and that sort of thing. But what is a story you hear every day when you walk in the communities around this county?
Thank you, Joe, for this opportunity. I must say that the cost of accessing health services is still very high to the normal mwananchi because currently we are talking about the direct out-of-pocket expenditure from the community, from the citizens, is about 24% of the entire expenditure. And the government, for instance, is contributing about 29%. And donors are somehow contributing 35%, and then 17% is by private sector. So this still shows that the burden of accessing health services is still very high, very expensive. And I think what needs to be done is to ensure that more resources are allocated towards the health sector, so that then the normal mwananchi does not have to pay so much. And then in some cases, as we have even seen in that video, we've seen that some women are actually not able to access services because they have to really engage through very expensive methods of accessing these health services.
Okay. So we will have some responses here in a short while, but I want to get some initial thoughts from the floor, and my colleague Mashirima is on standby to get us some questions, comments, or whatever from the audience.
Naam, Jo, kuna jambo ambalo limetajwa hapo kuhusiana na ambulance, na nitasonga kidogo nimtafute Asma Said. Asma Said, uko upande gani? Asma. Okay, hai. Asma alikuwa na swali kuhusiana na ambulance, na ni jambo ambalo gavana amelitaja. Labda ataweza kufafanua yeye anafikiria nini kuhusiana na kile ambacho gavana amesema na yale ambayo yanaendelea mashinani.
Jina langu ni Asma Said. Swali langu ni kuhusu hilo ambulance. Kuna zile hospitali ndogo ndogo ambazo zimeoneshwa Junda, Mlango Saba, watu wanajifungua wanapata shida. Sasa ikiwa ambulance ni moja kwa kaunti zote ni 6, kila moja iko moja. Je, yule mama alijifungua, saa nyingine hana zile pesa za taxi. Jama, ikiwa kuna ambulance kama 2, yawezekana yule mgonjwa achukuliwe haraka apelekwe Makadara kwenda kujifungulia. Mimi langu naomba uongeze ambulance kwa kila hospitali ndogo.
Haya. Sijui kama hilo swali linaweza kujibiwa, ndio tuendelee na swali lingine.
I want to agree with her that certainly we need more ambulances, without a doubt. But then, as governor, I really had to make a choice. Where do we put in the money? Shall we put in the money in the ambulances or the much needed facilities within the areas that you come from? And the first choice for me was now to invest in the facilities. And that is why we opted to build the level 4s in the 6 sub-counties. In fact, in certain areas, we've had to do 2 because of accessibility. But I can tell you, we want to do the ambulances, yet we realize the most important one is to give you medical care so that you don't need to board an ambulance. And I can tell you from what I saw from the TV with Mashirima Kapombe's story is that lady actually decided to go to Coast General by choice. She wanted to go to Coast General, but there were facilities near her. But yeah, mwenyewe to decided, you know what, I'm likely to develop some complication and nini, which is a good thing in a way, but also, really, we have put in those facilities down there for you to use. But I can tell you, ambulance sasa ziko 2 for every sub county, or basically constituency. And we'll get to a point tuongeze zaidi, lakini mimi nataka tufanye sipitali so that una haja ya kupanda ambulance, pate sipitali pale mtaani. For me, that's, I think, is the right way to put in your money.
Haya, Hope Baraka naye ana swali lingine kuhusiana na msongamano nadhani katika hospitali ya Coast General.
Your Excellency the Governor, swali langu ni kusema kuhusu kwamba kwanza ningependa kusema I think we have one of the best facilities at Coast General. Very well equipped. Very well equipped. My question is, what vision do you have for, to take care of people moving from here to other parts of the world seeking medical attention? We can see a lot of people asking for support to go to India, some WhatsApp videos. So what vision do you have?
Let me say this. First of all, you see, some of this care requires specialized training. And I can tell you, when we got in, I realized Coast General had a very lean number of consultants. And And therefore, it's a challenge to offer certain kind of treatment. That is why we said it may take a while, but we needed to invest in equipment. Today, I can challenge anybody. We have the best ICU facility in the entire republic. And I want somebody to go around the country and come and tell us what we have. We're investing in cath lab so that we can deal with diseases within. But now that we don't have, we're in partnership with Aga Khan, because we have some certain facilities that they don't have. And it's rare, by the way, at a public hospital in a facilities about private haina. But we've developed a model to co-share so that certain matibabu can be sent to Aga Khan at a subsidized cost. Likewise, Aga Khan can also deal with us on certain areas. But as we sit here today, Mombasa County has sent out 42 doctors for further training. We have sent out 6 oncologists because we realize a lot of our challenges is to do with cancer. We've done our cancer center, but we still have had to send people to Nairobi. Radiotherapy, nini. So we have invested in that. We are commissioning the construction of a radiotherapy in January. We have 42 doctors out in Egypt, in India, in Nairobi, and other facilities to get what? Specialized, so that when they come, we do not now have to send our people to India. We bring the technology here, and that is a conversation we had when we're doing the equipment with the national government. We said, you know what, we can equip everything, but if we don't have the human resource capacity, then we've made no progress. So we are at a point where we now are training our doctors. I can tell you, you may take it for granted, but this is a county that has employed over 700 nurses. We have 240 doctors and 42 specialists today. Mombasa County has hired, I can tell you, we have hired almost all the senior doctors in the county. We have gone to Aga Khan, we have gone to Pandya, we've negotiated, we have gone to Heda. We even, Dr. Kandwala, we poached him from Aga Khan. This guy was managing Aga Khan. I went and convinced him to come and join Coast General. Today he's running Coast General. And that is why we are able to transform Coast General to what it is today. So, for me, it is work in progress. And the point is to do what? To look at where we've come from. Coast General could not do open heart surgery. Today we are doing it. We're going to do kidney transplant here at Coast General. Na sasa sisi tu, by the way, so that you know, even me, I get treated at Coast General. When I become ill, I go to Coast General. People don't know this, but I go to Coast General. My doctors are from Coast General. Because I want to do what? I want to build a facility in that when I leave office, because I do not know what the future holds. You never know, mambo ya Mungu, sio? So tomorrow, I should be able to go to Coast General and get treatment. If there's a need, isn't it? And that is where we're headed. So, certainly there's a lot of improvement, my dear sister. We need to do a lot, but we have already recorded quite some progress. But it's obviously evolving afya dynamics and a change every day. So we'll continue to think. We always have to think on how we can be innovative and responsive to what? The challenges of the moment.
Okay. Any other question?
Tugeuzegia kidogo, kuna swala hapa ambalo lilikuwa limetajwa awali kuhusiana na vijana hasa wale ambao wanarekebika baada ya kutumia mihadarati. Suleiman.
Shukran sana. Your Excellency, I have this question directed to you. Currently, we have Kisimani Health Center, which is offering methadone. And it is the only center that is depended by all the sub-counties. So we have a majority of people who are accessing this site for their daily dosage of methadone. And the numbers are really overwhelming at that particular site. So our appeal is that we are appealing to your office that we have decentralization of this methadone dispensing site. So we are kind of asking a question to you. Vipi ofisi yako inaweza kuharakisha mikakati kama hii ili tuweze kuokoa wengi wale ambao wako katika magatuzi ambao yako mbali na Kisauni ili waweze kupata huduma hii mahali walipo?
Na tafadhali uweze kuzungumza kwa Kiswahili pia, maana kuna watu wengi sana hapa pwani ambao wanazungumza kwa Kiswahili.
Sasa yule niuliza Kizungu na ikabidi nijibu Kizungu.
Hata amemalizia kwa Kiswahili nafikiri.
Acha nimwambie, first of all, nataka ujue the methadone program in Mombasa is a success story. Kwanza, I want you to know there are people coming from as far as India, people coming from South Africa kuja ku benchmark what we've already achieved in Kisimani. Lakini nakuunga mkono that we need to do what? To do more. And by the way, sasa technology pia inabadilika. Tunaangalia other options. Kuna options sahi we are evaluating ya implant so that we complement methadone. Lakini methadone tunafanya pale sasa Potriz, methadone, Likoni, all right? But we want to do more. Mimi napenda vile ulivyosema bro. Unajua siku zote watu stereotyping, negative energy, kila mtu anaangalia rehabilitation ya vijana. What we have achieved over the last 4 years or so haijawahi kutokea. But we will not come out here tuanze kupiga kelele tumefanya. Wale ambao wanahusika they feel the impact, isn't it? Lakini mimi siwezi kukuambia Kiswahili kingi. I agree with you. We certainly need to do what? To do more. So tutafanya hiyo. Kwamba na uzuri je mimi ni governor boss. Toa amri tu nafanya. Natoa amri sasa hapa, natoa amri we CC you get it sorted out. Tafuta ma container method.
Naona Dr. Manjari pia na
haraka.
You have some comment on
Yeah, I'm very glad that the governor is actually very focused on the issues of improving health. We want to support him as KEMSA and confirm that we have methadone in plenty. And this methadone, by the time it's transported from our warehouse, it is guarded. There is no risk of leakage along the way.
Please explain to people who may not understand what this methadone is.
Explain in ngumu.
But what kind of drug is it?
It is a drug that is used for people.
Because that's a very difficult name.
It is a drug that is used for people who are addicted, and we are treating them to get off the hook from heroin.
And it has to be guarded.
Of course, because it can also be abused.
Okay.
And then the other thing that I wanted to say is that if the governor focuses on primary health care and community service, we will be able to support him, because we have come up with programs in the organization that we are empowering commodities that are in our service supplementary service division, and these commodities will be offered to the counties for that purpose. I'm very glad that he is also focusing on non-communicable diseases, and we have prioritized as an organization to buy commodities for hypertension, for renal services, for a cath lab that he has talked about, and we'll be able to support as an organization, and also to empower the mental services in the counties. So glad that these are happening in the counties, and services are reaching the common mwananchi, and as an organization, we are very proud that we'll partner with counties, especially Mombasa, for us to offer services to the mwananchi.
Thank you.
All right, so we will come back here, but we need to take a break right now here on Citizen Monday, a special town hall coming to you from County 001 here at the Aga Khan Academy. Don't go away.